There is a new clinical trial underway at the Veterinary Teaching Hospital at the U of I that is taking a hard look at a widely used approach to treating a chemo side effect. Here now is Dr. Matt Berry and Buster the dog. Welcome, Dr. Berry,
thank you.
Welcome to you, Buster. You are a gorgeous dog. Dr. Berry, before we talk about your research, let's talk about Buster.
Yeah, Buster here belongs to our clinical trials technician and manager, and he's just supportive of cancer research. So he is available to us as we need to collect normal samples like blood and urine to be able to compare to cancer patients.
So he's a good, healthy dog, and he's helping you guys fight the good fight.
That's right.
That's awesome.
Right. He's a great supporter for us.
Now tell me a little bit about this new study that you guys are doing. This is a clinical study that involves dogs that are being treated with chemo for cancer.
That's right.
And a very specific side effect.
Yeah, that's right. So this trial is very different than what other clinical trials look like in our hospital. Most of the trials that we have are testing really specific cancer-directed treatments or new equipment, new technology. This clinical trial is unique in that we're investigating how we support the cancer patient through chemotherapy. So generally, chemotherapy is very well tolerated in dogs. About 80 to 90% of dogs will have no outward side effects of chemotherapy treatment. But we can see side effects. One of them is diarrhea. And diarrhea can alter quality of life, pet owner perceptions of what we're doing, and ultimately can make them more sick if they are going to experience other chemotherapy side effects.
Now, is that because of like the dehydration, lack of nutrition, everything's just processing through their body?
That's right. And another common chemotherapy side effect would be myelosuppression, meaning the body can't protect itself from normal infections. And if there's diarrhea happening, we worry that the GI tract could be the source of a bacterial infection.
Which could create all kinds of problems.
That's right, yeah. And so this clinical trial is unique in that we're evaluating a commonly recommended first-line medication for chemotherapy-induced diarrhea.
Okay.
So the drug that we're really testing and hypothesizing doesn't work to manage this is called metronidazole. Metronidazole has been long recommended for a first-line therapy for diarrhea, not just chemotherapy-induced diarrhea. But its use is largely theoretical. There's been no study to show that it truly helps. And what we're worried about now is that that theory is outdated, and it doesn't actually help shorten that resolution time of diarrhea, and it may actually be negatively impacting gastrointestinal health. So this study is really important to prove that it doesn't work, so that our practice and the entire veterinary oncology community can move forward and test things that should shorten that diarrhea resolution.
Have some better solutions in the future.
That's right. Yeah.
So that's fascinating, and ultimately that really comes back to help pet owners and help our pets, because if we're not giving them the medicines that they need, or if the medicines that we're giving them don't work, then that's a big problem.
That's right. This diarrhea caused by chemotherapy is a self-resolving problem, meaning if we don't do anything, it's going to improve. But we just need to find ways that we can better manage it, shorten that time.
Which really, I imagine it's not fun for the dogs when they have to go through chemo plus have those awful side effects. How many dogs does the diarrhea side effect affect? Is it all dogs going through chemo, or is it a subset of dogs?
Yeah, not all dogs, and it's actually really uncommon for us to encounter side effects of chemotherapy in our canine or feline patients. So I think our goal of treatment is a little bit different than in human oncology, where I want my patients to have an improved quality of life or maintain a good quality of life all throughout the chemotherapy protocol. And so it's just a way that we have to investigate if side effects are going to occur. How can we best support those patients?
That's incredible. And it's this kind of work that people most of the time aren't even aware that's happening because we don't see it. But it's this kind of work that really comes back when we do take our dogs to the vet, when they do have a problem. It changes our lives, it changes our pets' lives. So thank you so much for running these studies, for doing the work that you do. And if you want to learn more about this trial and everything happening over at the Veterinary Teaching Hospital, we're going to connect you on our website at ciLiving.tv after the show.